Thank you for your service. For all my servicemen and servicewomen watching this video, I thank you wholeheartedly. Uh, and as always, my love and heart goes out to you. But this is the type of background people usually say they want in positions like this. And here's what this actually means in real life. The CDC director isn't just a title, it's a role that influences how the country responds to major health situations. Guidance that affects schools, workplaces, businesses, and everyday life flows from leadership like this. We all seen that during COVID. Whether you agreed with those decisions or not, you saw how much impact they had. So when someone steps into that role, the real question should be, can they handle the responsibility? Do they understand both the science and how policies actually affect people on the ground? And this is where it starts to feel inconsistent again, because for years we heard trust the experts, follow the science, listen to qualified professionals. But now, when someone shows up who checks those boxes, the conversation shifts away from qualifications back into politics. So now it's not, is she capable? It's, who picked her? And that becomes the deciding factor for how people react. To be fair, some skepticism is understandable. After COVID, a lot of people lost trust in institutions. People felt like information changed too often, like decisions weren't always clear or consistent. That's real. But there's a difference between asking fair questions and dismissing someone before even looking at their record. And right now, it feels like a lot of reactions are skipping straight to conclusions instead of actually evaluating the situation.
So President Trump just nominated Dr. Erica Schwartz to be the next CDC director. I'm going to tell you right now, I am so impressed with her. She's extraordinarily impressive. And I literally had to write it down because she has so much experience. She has a rare mix of qualifications in medicine and health. She's been working in the health industry for over 25 years. She was the former Deputy Surgeon General of the United States from 2019 to 2021. I actually had to write this down because there was just so much. So she is also a retired Rear Admiral in the U.S. Public Health Services Commission Corps. She's a former Chief Medical Officer for the U.S. Coast Guard. She has over 20 years in federal health leadership roles. She has her MD, she has a master's in public health, and she has her law degree, or JD. She has experience with medicine, policy, public health. That's a rare mix of experience, but it's perfect. So the CDC director is a massive role. She would literally be in charge of the most influential health organization in the world. For this role, you need to be able to track and respond to outbreaks, manage or properly manage national health emergencies. You need to be able to provide public health guidance. You need to be able to issue public health recommendations to the public, be setting guidelines for hospitals, states, and agencies, overseeing research and data analysis,